Doctors prescribe number of different drugs to patients throughout every day. Some types of medications are considered safe drugs that even pregnant women can take, while few are considered high alert medications. Although medication errors can occur with any type of drug, the consequences are heightened when mistakes are made with high alert medications. This session on HRM includes the objectives as follows: to know the actual definition of HRM or HAM drugs, validated list of HRM, usual risk factors associated with HRM that may lead to medication error, the definition and common causes of medication error, the vital role of pharmacists and nurses in HRM management. For better understanding the actual scenario, case reviews will be discussed as and when necessary. At the end of this session, the viewer should be able to identify the HRM or HAM in his or her regular practice and the risk factors involved while handling such medications. Be extra cautious to minimize the medication errors due to HRM and communicate if any untoward incidents occur involving HRMs. Here, we begin the introduction session with a typical case scenario. This case scenario explains about the consequences of dispensing a wrong drug due to his or her inability to distinguish the prescribed drug. Sadly, significant harm can result if a patient receives the wrong dosage or another medication error is made involving a high alert drug. When doctors or pharmacists or nurses make high alert medication errors, patients can suffer an immediate life-threatening condition, permanent injuries, or even death. Thus, drugs with narrow therapeutic index, a slight change in the plasma drug concentrations, can lead to overwhelming effect with significant damage to the patient's life. On inappropriate administration of these drugs can lead to a medication error. Here, we can find a validated list of medications classified under HRM. The common factors considered for the fact of risk leading to errors while handling HRM are as follows. Firstly, improper written prescription can give rise to lot of ambiguities and misinterpretations of the prescribed drug or their details. Secondly, the sharing of similar alphabets between drug names and similarity in the packaging and labeling of the marketed products are considered to be look-alike and sound-alike drugs. The use of unusual signs and short form of representing a word may lead to devastating errors, especially in terms of drug dosage. Labeling and packaging problems can create a state of confusion for the pharmacists while dispensing the prescribed drug. As you can see in the top right picture in the slide, mannitol injection and sodium chloride injection are having similar appearance, so mistake can occur while dispensing either of these drugs. Poorly written prescriptions are as example in the second picture. The name and the dose of the drug has been written in the same column, which should be avoided. In the third picture, prescriber has used inappropriate abbreviations as well as mentioning the dose and frequency of administration is unclear. Medication errors are preventable errors made by health professionals, which can lead to inappropriate medication use, thus harming the patient health. Such events may be related to professional practice, healthcare products, procedures and systems, including prescribing, order communication, product labeling, packaging and nomenclature, compounding, dispensing, distributing, administration, education, monitoring, and use. These describe the ideal causes for medication error according to ISMP. Miscommunication or failed communications can lead in medication error, such as unclear handwriting or miscommunication taking place among health professionals in telephone may lead in misunderstanding while dispensing drugs. Drugs which are named similarly create confusion in dispensing drugs, leading in medication error. Drugs, when not written in capital letter, can lead to misinterpretation in terms of identifying the drug. Dosage for a medication, which are in decimals if missed or not written visibly, cause medication error. Use of abbreviations or short forms which have not been practiced or listed to be practiced in a prescription before are called as non-standard abbreviations. Similarly, environmental factor such as stress while working and technology or equipment which are insufficient in managing affluency among the working staffs leads to medication error. Examples of non-standard abbreviations are as shown in the pictures. The top picture is a medication error of appropriate dosage. The bottom picture relates to illegible writing by the physician that can lead to medication error. Likewise, other causes are: there is always a risk of error when staffs other than a pharmacist is involved in activity requiring participation or supervision by a registered pharmacist only. When drug is needed to be dispensed to more number of patients in short time, error can occur. When the pharmacist cannot concentrate at the prescription to be dispensed due to loss of interest. Drugs having similar appearance but different indication, if dispensed incorrectly, lead to error. Double checking not of concern among the pharmacists. Dose miscalculations, especially in population at risk. Shortage of staff leading to work overload, stress among the staff and thus risk of medication error. Patient information, if is lacking, can cause medication error in case of calculation of doses, history of allergies with certain drugs, etc. Inability of pharmacists in counseling their patients in detail about each and every aspect of the drug therapy, including their benefits or complications. As we can see in the diagrams, these are look-alike medications, but their strengths are different. In such cases, the dispensing should be considered with proper checking of the doses. In addition, such drugs which have the same indication but different strength should be stored separately. Medication errors being preventable, the various processes or methods used to overcome the same are as follows. Drugs having same name as well as same appearance should be kept or stored separately in specifically designed shelves or with completely distinguishable techniques such that these drugs are dispensed without any confusion or error. Verification for drugs, both by brand and generic, should be made for oral as well as written prescription. Patient counseling about brand names which can be different for the same generic of the drug and on every aspect required to be followed by the patient while administering the drug. Drugs having similar appearance and sound should be alerted in the shelves in respect with their similarly sounding or looking in a distinguishable manner. Double checking the vials and bottles for injections and infusions before dispensing is necessary. Pharmacists have a crucial role in management of HRM or HAM medication. Specific strategies are needed to be implemented in order to manage dispensing such medications, following which medication errors can be minimized, leading to a better patient care. These are the few strategic points that are needed to be considered. Clarification of the written prescription, which is not clearly legible and understandable, so that there is no confusion while dispensing HRM or HAM medications. Use of inappropriate abbreviations or unclear or incomplete short form, especially for units by the physician, should not be accepted at all and should be referred back to the prescriber. As well as abbreviations or short form used while mentioning the drug names and dosing frequencies should be clarified with the prescriber properly. Doses which are unusual should always be confirmed with the prescriber before dispensing the HAM or HRM medications. Doses should be mentioned along with their metric units such as for weight, gram, milligram, microgram, etc. The prescriptions, which does not include such information, should be clarified, except for fixed dose combinations and local applications. Unclear indications used should be clarified. The prescription drugs might be interacting with each other as well as might interact with foods, which may lead to undesired effect, Thus, this matter should be considered wisely before dispensing the drug. Medication safety is a process through which we can prevent any unwanted harm from appropriate and safe usage of medication, contributing in significant improvement in the health and well-being of patients. Medication safety issues can impact the health outcomes, length of stay in a healthcare facility, and overall costs to the patient. The main role of pharmacists in medication safety has been categorized in three broad areas: at hospital, in clinical areas, and in community. The responsibilities for a pharmacist in hospital for both in and outpatient are: in the dispensing area, following established policies and procedures, checking of accuracy of work of other fellow supportive personnel, maintenance of professional competence. Specific techniques for extemporaneous compounds should be followed. Inpatient care areas, ensuring sufficient stock of drugs are reaching to the nursing station. General responsibilities are providing drug information to other departments, managing pharmaceutical needs for ambulatory services, and providing adequate control. In clinical field, a pharmacist performs the following vital roles. These are the vital roles of pharmacist in community: correctly and safely dispensing prescription medications to the public, communicating and liaising with the doctors in case of misinterpretations, patient counseling on treatment of minor ailments, patient counseling on potentiality of any adverse side effects or any interactions with other drugs, overseeing the order and safely storing the medical products, and in some cases, delivering the medications to the patient, keeping up to date with modern techniques and practices, managing, supervising, and training pharmacy support staffs. Thus, HRM or HAM have a high risk of causing significant patient harm or death when used in error, and take all the necessary measures to avoid and minimize medication errors and reporting such errors. We acknowledge Rajiv Gandhi University of Health Sciences for their continuous support. Thank you.